Hey, welcome to What's ZEE. Today, I'm breaking down a word that sounds way scarier than it usually is. Biopsy. Don't worry, I'll explain everything you need to know super simply right here, so let's dive in. First things first, what even is a biopsy? In the simplest terms, a biopsy is a medical test where a doctor takes a tiny sample of tissue from your body. Why? So they can check it under a microscope and figure out what's going on. It's kind of like taking a small piece of cake to see what flavor it is, before serving the whole thing. Alright, but when do doctors recommend a biopsy? Usually it's when there's something unusual, maybe a lump, a spot, or a change that showed up in your blood work or on an X-ray. It's not always about cancer, by the way. Biopsies help diagnose all sorts of things: infections, inflammation, even some skin conditions. Now you might be wondering, how do they actually do it? Well, there are a few ways. The easiest is a needle biopsy. The doctor uses a thin needle to grab a tiny piece of tissue. Think of it like poking a straw into a juice box. Sometimes, especially for skin issues, they'll do something called a punch biopsy, which is kind of like using a mini cookie cutter. And in rare cases, they might need to go in with surgery to get the sample, but in most cases, you're in and out pretty fast, sometimes in less than half an hour. Now let's talk about the big question: does it hurt? Honestly, most biopsies are done with some local numbing, so you'll feel a pinch or maybe some pressure, but not much else. And if you're nervous, totally normal. Let your doctor know. They're used to it, and there are ways to make you more comfortable. So, what happens after? The tissue sample goes off to the lab, where special doctors called pathologists take a close look. They can spot everything from infections to cancer cells, or sometimes, nothing to worry about at all. Usually, you'll get your results in a few days, but it can take longer depending on what they're looking for. Before I wrap up, let's clear up a misconception. Having a biopsy doesn't mean you have something serious. It's just a way for doctors to get answers, fast and accurate answers, so they can help you get the right treatment, if you even need any. If you're facing a biopsy, remember, ask questions, talk through your worries, and follow any instructions your doctor gives you. And if you're watching this just to learn, congrats, you're now way ahead of the curve. Alright, I want to hear from you. Drop a comment below if you've got any questions about biopsies, or if there's a medical term that's been bugging you, and you want it explained in a future video. Thanks for watching What's ZEE. If you found this helpful, hit that like button, and don't forget to subscribe for more easy to understand answers. See you in the next video.